Okay. I'll give it one more minute so we can start on time and be respectful of everybody's time. We'll admit people as they come in. Okay, welcome everyone. We're going to get started. We'll keep admitting people as they come in, but we want to respect everyone's time. Good afternoon and welcome to the Caring Economy, caring for your employees who are caring for family. We are so excited that you could join us today for this important discussion on how employers can support family caregivers. My name is Lucinda Hurt and I'm the manager of Access Services and Community Programs here at HGuide. Before we get started, I wanted to review a few housekeeping items. This session is being recorded for future use. Please ensure that your microphone is on mute throughout the session. Questions can be entered directly into the chat and will be presented to the speakers at designated question and answer times in the agenda. Following the event, you will be led to a program survey. We hope you will complete this and provide us feedback on the event and what you found valuable and any suggestions you have for future events. Also following the event, you will receive an email with a packet with various resources, including surveys you can utilize in your workplace to identify caregivers and their needs, the AARP Employer Toolkit, and other additional resources. The link to the recording will also be provided in the follow-up materials. At HGuide, supporting people on their caregiving journey is a priority for us. So it is my pleasure to welcome our panel of caregiver service support experts. First, we will hear from Ellen Burchander, the Gerontology Graduate Program Director at the University of Massachusetts, Boston, who will discuss the impact of caregiving. Then we will hear from Tricia Sandiego, a senior advisor with AARP, who will introduce to us AARP's Employer Toolkit for creating more caregiving-friendly workplaces. And finally, we will hear from HGuide CEO, Marla Franczak, who will educate us on home and community-based services available for caregivers and their care recipients. We hope that you will find today's seminar beneficial and that it will inspire you to join us in creating a more caring economy that supports the work of family caregivers. Without further ado, let me introduce our first speaker, Ellen Burchander.
Welcome to Zoom. Enter your meeting ID.
Thank you, Lucinda, and thank you all for being here and for inviting me to participate in this.
Enter your participant ID followed by pound. Otherwise,
please make sure everyone's mic is muted, please. Thank you.
You are in the meeting.
So I am really excited to be here today to talk about the impact of caregiving. But before we get started, I have a couple of questions. My first question, and if you could go to your reactions button and just raise your hand, that would be great. How many people in the room have children school age or younger? Okay, I can't see all of you, but can someone from HGuide just do a quick tally?
It looked like so far 12 people, 14, 15.
Okay. Next question. How many of you have parents over the age of 65 or relatives who live with disability or chronic illness? Lucinda, can you do a quick tally again?
26, 27, it keeps rising. 28.
About half.
Yeah.
Okay. Okay, my last question, and this is something you can just quickly jot in the chat, and if someone could monitor the chat, that would be helpful. When is somebody old? And can someone look at the chat and see what the responses are? Oh, I see. They're coming up when they say they are, when they feel like they are, 85, when they're dead. Okay. Never. When they wake up. Okay. Some days are like that. Very good. Yes. Some days you feel old in the mid-40s, and then the next day you might be fine. 65 and depressed, when others make them feel old, and it depends on who's asking. Okay. Good answers. Very good answers. I've been teaching for a very long time, centuries, in fact, it seems some days. And I asked that question to a bunch of undergraduate nursing students semester after semester in a fairly progressive program. And there have been students who tell me that 40 is old and that 45 is old. And I can tell you that's, they fail. I'm kidding, I didn't fail them, but we had a very interesting semester of changing people's perceptions. I think we'll start. Can you forward to the next slide, please? I want to talk a little bit about our current population statistics. And I think that you'll find these somewhat interesting. There are currently 56 million people over the age of 65. By 2030, it'll be 73.1 million. By 2034, which really isn't that far away, older adults will outnumber the number of children in the US for the first time. And by 2050, which is less than 30 years from now, there will be 90 million older adults in the US. Now, this is kind of interesting because life expectancy in 1922 was 58.4 years for a man, which when you think about it, that's kind of young. And in 2022, it's 79.05. So our life expectancy continues to grow, although statistically with the pandemic and some other factors that we're facing worldwide, it's leveling out. Each generation successively may not live longer based on some worldwide the pandemic and some other trends that are happening. So it may level out a bit, but still, that's for successive generations. As we stand now, this is how our population is going to change. Next slide, please. This is it graphed. Take a look at 1960 to 2060, 100 years, and our population has changed dramatically. Next slide, please. So I want to talk a little bit about what our caregiving statistics are. So you might ask, well, why is this really important? And there are a couple of reasons. One is that people are living longer and they're working longer. So they're working into older ages, which impacts businesses and our economy and our society. But also people have greater caregiving responsibilities. As people live longer, they live longer with greater disability and more need. And so people who work even older continue to have caregiving responsibilities. So there are reported 53 million caregivers in the US, or there were in 2020, which means that approximately 1 in 5 people are caregivers. Now, 39% of them are men, 61% are women. That's not surprising. And 64% are working. That means 23 million people, or 1 in 6 people who have caregiver responsibilities, are in the workforce. And 45% report experiencing a financial impact. That's a lot. That's over 23 million people, almost 24 million people are financially impacted because of their caregiving responsibilities. And we can talk a little bit about what that means, but let's do the next slide. So just to tell you, give you kind of an idea of who the caregivers are. 7% silent generation. Most of that generation are caring for spouses. 34% are baby boomers. Some are spouses, some are caring for parents. 29% Generation X, caring for older relatives. Millennial, again, older relatives, and Generation Z, older relatives. Next slide, please. So this is how much it's changed. And I put this in here because it's changing quickly. There are 10 million more caregivers from than in 2015 to 2020, there were 10 million additional caregivers. And from those years, in 2015, 18 were caring for more than one person, 24 in 2020. And the difficulty coordinating care went from 19% to 26%. And the number of people caring with someone with dementia went from 22% to 26%. And you may ask, well, does that make a difference? And when you're caring for someone with dementia, the types of caregiving responsibilities are very, very different, and they take a toll in different ways. I don't know if we'll have time to discuss that at greater length today, but it's something that is really important to know. And of the caregivers, 17% reported poor health in 2015 and 21% reported poor health in 2020. This just indicates that caregiving takes an incredible toll, and it's something that we need to be aware of. Next slide, please. So in Illinois, I got most of this from AARP in Illinois. Thank you very, very much. 47% of voters 50 years or older have caregiver experience. 64% worked while caregiving. 22% of Illinois' population is over 60, which says something. And 11.5 of the people who are 65 years of age or older live alone. So when you think about that, that's pretty, that's a number to note, because of when people are alone, they can often experience loneliness or social isolation, which impacts their health care, which impacts their ability to care for themselves, which impacts their need for caregivers. Approximately 230,000 are 65 or more and living with Alzheimer's disease or a dementia. That's significant. Now, when we think about caregiving, you know, it encompasses a wide variety of responsibilities. It could be anything from buying groceries or doing doctor's appointments to daily care. So it's pretty broad. Next slide, please. In Illinois, continuing, 1 in 5 people are caregivers. Half have been caregivers for more than 2 years. 58% are women, which is just slightly lower than the national average. 16% of caregivers are over 65, and 40% care for a parent. 9% care for someone with dementia. And this statistic is staggering. 33% of caregivers provide 20 hours a week or more of care. So think about that. If they have a full-time job and work 40 hours a week and provide 20 hours a week of care, that's 60 hours right there. Let's assume they have to sleep. Well, let's hope they sleep 56 hours, but chances are they don't. That already is 120 hours a week. So when do you do things like grocery shop, you know, put a vegetable on a plate, and really provide do basic things like spend a little time with your family or pay attention to your spouse? You know, it's very, very difficult when you think about that. for those of us who are workaholics and work 60 hours a week, we know there's no time for anything else. And so I'm sure many of us here can understand that that's a lot when you have other caregiving responsibilities. So 80% of assistance is with household chores and 20% provide assistance with personal care. Providing assistance with personal care adds additional emotional stressors. Next slide, please. So there are a variety of issues that caregivers face. Fatigue, decreased physical health, depression, anxiety, sleep disorders, lower immune response, stress. But it goes even further. When you think for people who care for their parents, who have the responsibility of caring for their parents, the dynamics of the relationship change. When your parent is your parent, and their responsibility is to be there for you. They've raised you their whole life. They're your safety net. They're your support system. And now when you become their caregiver, there's role reversal. Now you have to take care of them and make sure they're getting what they need. In addition, you may have your own children and your own work and your own responsibilities. So in addition to increasing your role and increasing your responsibilities, you lose something. You've lost the person who unconditionally took care of you or who supported you. And granted, you're an adult and you can handle it and you manage your own life and you might be very successful in a variety of aspects of your life, but your mom is your mom or your dad is your dad. And that emotional and psychological toll is something that caregivers have to deal with. And that's not always easy. And so, and it's not something that is, that people talk about with you, or it's not something that you expect to have to deal with. And so it complicates everything. Next slide, please. Other common caregiver issues, cognitive impairment, brain fog. If you had COVID and you had brain fog, you know what that feels like. Inability to make care decisions. You may be able to do almost anything, miraculous stuff in your life and in your work. But when it comes to making decisions about someone you love, it's often overwhelming. And it's also not uncommon to be ambivalent. Why do I have to be the caregiver? Why do I have to take mom to the doctors? I don't have time for this. When do I have time for me? What about my kids? What about my husband? What about my work? Why do I have this responsibility? And in the United States, we are not legally responsible for our parents. We have no legal responsibility. We do, however, have an ethical responsibility to care for people we love. And that's something that we need to pay attention to. So ambivalence and guilt are often emotions that caregivers face. They also often experience family strain and relationship stress because they have competing responsibilities. Okay, do I take mom to the doctor or do I go to volunteer at my daughter's school? And oftentimes it's just overwhelming for people. Now, we mentioned financial distress earlier. It is very, very difficult to maintain family responsibilities when they're this intense and be able to work in the traditional American way, which is a minimum of 40 hours a week, and focus and be productive and move forward and, really be, really be engaged. And so oftentimes work suffers or people pull back on their work. In addition, caregivers often contribute personal income, personal resources towards the care of their loved ones. And that is expensive. Just I don't know what it is in Illinois because I didn't look it up, but in Massachusetts, if you have a home health aide come into the home for your mother and you're paying privately, it's $30 an hour. If you minimally $30 and up. So I'm sure it's probably comparable. That's a lot of money if someone needs personal care every day. Caregivers often experience decreased quality of life. There's no downtime. There's no self-time. The phone rings in the middle of the night. You wonder if mom's fallen. You wonder what happens. And so there is no time for self-care. In addition, there are few resources and there is a serious lack of support for caregivers. Next slide, please. So again, I'm going to talk just a minute about more negative financial impact because this is long-term. There are few protections, financial protections for caregivers. Now, we do have the Family Leave Act. Okay, so in addition to have worked in the field of aging for my entire life, I was also a caregiver for both of my parents. And at a time when the Family Leave Act didn't exist, and if I didn't work with some people who I love dearly and who I'd worked for a long time, I wouldn't have had a job because I had to pull back and work part-time. I chose to take contracts instead of a benefited position. So what does that do? I mean, I was very lucky because I had a work environment with people that I'd known and loved for a long time. So that was great. But for people who don't have other resources, if you take a contract job, you're not contributing toward your retirement. So, and if you work part-time, your salary is less. If you are caregiving, chances are you are contributing to the care of that person, and so your expenses are greater. There is also no protection against employment discrimination. If someone has caregiving responsibilities and they are unable to continue to do all of the things that they need to do, then they oftentimes are experience some sort of discrimination. Okay, there are a variety of tools. Right now, there are no retirement protections, but we're going to work on that. Next slide, please. So there are 10 million caregivers 50 and up who care for parents, and an estimated $3 million in wages, pensions, and retirement funds and benefits are lost. They're higher for women, the losses, and lost wages for women who leave the workforce early because of caregiving responsibilities totals 142,693. Women tend to feel this a lot more than men. Next slide, please. Now, employers grossly underestimate the direct and indirect costs of unpaid caregiving. According to Blue Cross Blue Shield, the economic influence from caregiving is estimated at $44 billion, and through the loss of 650,000 jobs, and 800,000 caregivers suffer from workplace absenteeism. So imagine what that does. So the indirect economic effect of caregiving comes to about $221 billion. That's a ton of money lost because of caregiving. Next slide, please. So, impact. 53% were late, 15% worked part-time from full-time, 8% got attendance warnings, 7% turned down a promotion, 6% quit their jobs, and 5% retired early. That's a huge impact. Next slide, please. More than 80% of employees report caregiving duties affect their productivity. And the unplanned absence and late arrivals or leaving early are 3 behaviors that not only hinder the employee in their career, but also productivity. And what's worse is when people are at work, they might be distracted. Next slide, please. So what do we do? How do we improve? Our goal is to improve productivity, improve the caregiver's ability to perform, improve caregiver satisfaction and retention, and improve well-being and support a positive workforce environment. Next slide. So how do we do it? The first thing is to create a culture that is supportive and welcoming to caregivers. You can verbalize your support. We've learned through COVID that we can be flexible with work hours and locations and still be productive. That does not mean that everybody should work at home, but flexibility is often key. Sharing information, there's lots of national, local, and community caregiver resources available, and having that available to employees is helpful. And also initiating employee caregiver support groups offer options for employees to at least feel supported. And you can do that via video conferencing or in person, and it just provides a safe environment and allows people to share ideas of how to balance work and caregiving. And it costs, oh, and I have a typo, I can't spell. It costs the employer little to nothing. Sorry about that. Next slide, please. So the benefits caregivers said that they use most were flexible scheduling, remote work, reduction to part-time, job sharing, and specialized caregiver services. Next slide, please. So I just wanted to bring this to your attention. The RAISE Act Family Caregiver Resource and Dissemination Center. RAISE is Recognize, Assist, Include, Support, and Engage. It's from the Family Caregiver Act. This organization directs the U.S. Secretary of Health and Human Services to develop a national family caregiving strategy. And it funded Resource and Dissemination Center, and it's a policy program and research hub. And the initial report went to Congress in 2021, and the strategy was released in 2022. Next slide. So we're not alone in this. This is a societal approach to addressing caregiver needs and how it's impacting our society. So all of you individually may be experiencing this, but everybody is. And so the federal government and a group of organizations got together to develop a national strategy. There are 350 federal actions to be taken over the next 3 years. And there are 5 goals: increase awareness and approach, advance partnership and engagement, strengthen services and supports, ensure financial and workplace security, expand data research and evidence-based practices. Next slide, please. And goal number 4 impacts you. Workplace security for family caregivers and family caregivers, obviously. Family caregivers can provide, the goal is that family caregivers can care for their loved ones without negative impacts on their near and long-term financial health. They have access to employee-centered flexible workplace policies and practices that support work-life balance. They have access and use of financial education and advanced planning tools. And the 4th is that long-term services and supports are more affordable, allowing family caregivers to reduce their out-of-pocket costs, because right now it's very expensive. Next slide, please. So I just put together a list of resources for employers, and I believe that these resources are going to be included in the package you receive at the end of today's program. Next slide, please. It is very scary, Courtney. Okay, and I think that's it. Thank you very much for your time.
Are there any questions for Ellen in the chat? Any more that are unanswered? There is one here, Ellen. It says, they're curious about if there are any statistics about respite care for caregivers in the federal level and state level. I'm not sure the specifics that they're looking for. We certainly have access to Illinois or our region and how many, how much respite care has been provided. I don't know if you have any other feedback on there.
I don't have statistics off the top of my head about utilization for respite care, but I can tell you that the federal government, CMS, has just issued a variety of ARPA grants, and one of or ARPA money for states to implement in terms of grants, providing grants to a variety of organizations. One of them is for the provision of respite care. And so that's currently, I don't know what Illinois is doing with that particular money in that grant process. But I know that there are several states who are in the process of developing RFAs for distribution for the provision of respite care. And each state has the option of developing the RFA to meet the needs of their particular state. So that's something that will be coming down. Every state is different. Every state offers different opportunities for respite. And I honestly am not versed in what Illinois is doing.
I can speak to that a little bit. The state of Illinois, like you said, we received ARPA funding, so the area agencies all have the ability to, kind of tailor that funding in their separate regions. Here in our region, we did allocate additional funding for respite and other caregiver services. And the state, for the first time this year, also awarded $4.4 million statewide for additional caregiver services, including respite. So that was, again, spread statewide. So of course, we received some of that funding in our region to enhance caregiver services as well. Any other questions for Ellen? You're welcome. Okay, thank you so much, Ellen, for all of that great information and for setting the stage for Tricia San Diego from AARP, who will now discuss the resources available for employers through AARP.
Hi, everyone. Welcome. I hope you can hear me okay. Thank you so much for having me today. And Ellen definitely set the stage perfect for the next part of my presentation here, which is really focus on our caregiving resources for the employer and the employee. Just a little bit about myself. I'm Tricia San Diego. I'm a senior advisor on AARP's Family Caregiving and Health team. I'm actually a caregiver myself. My parents are in their 70s and 80s. They've sort of slowed down throughout the years, but only just recently have really had a number of sort of health conditions that have creeped up. My mother has an autoimmune disease called myasthenia gravis. My father has just been diagnosed with Parkinson's, and I've really felt the impact of me trying to sort of balance helping them out. They live local, but not with me, as well as all the other things I have going on. I have 2 young children at home and my family and my husband. I'm what you call a sandwich generation caregiver. But at AARP, we like to refer to people who are kind of stuck in the sandwich generation as being in a panini generation because you're sort of pressured on both sides. So the work that I do is really about working with employers to encourage and influence more employers to do more to support working family caregivers. In Ellen's presentation with all the stats about caregivers, actually the one number that's interesting is 61% of all the 53 million family caregivers there are in the US, 61% are working either full-time or part-time while juggling this sort of other job. We heard up to 24 hours on average, and most likely that other job, although is a job and it is work, is mostly likely not paid. You're balancing your daytime job with this other activity that most people feel like they need to do, and it's part of your duty or it's a responsibility that you feel like you want to do. So it's a lot to balance. So what we're doing is providing resources. And I know that I was tasked to talk about one of our toolkits on family caregiving in the workplace and how employers can support, but I actually have a large number of tools and toolkits that I want to share with you today. Next slide. So just in general, here's our main website, arp.org/employer caregiving, which is going to list all of the tools that I'm going to talk about for employers. You're welcome to check out that website, and it's going to have all the major ones that I'm talking about today. I also have our email on this slide, askcaregiving@arp.org. If you have any questions after the session or any comments that come to mind, I'm always happy to have conversations and discussions and work with employers, work with organizations to see what we can do together to help improve the situation for working family caregivers who are truly, I think, the backbone of our long-term care system. And there's so many benefits that can be reaped on both the employer and the employee side when family caregivers are supported. We have here on this slide, just to name a few, things like workplace loyalty, increased recruitment, retention, a boost in productivity and morale. And then there's also a return on investment that we were able to calculate. When employers support family caregivers, there is a business case, there is a return on investment. And then also just providing a more inclusive caregiver-friendly culture. Next slide. So here's just a couple toolkits that I'll start with. Our first one that I have listed here is our Caregiving ERG Toolkit. Ellen talked about employee support groups for caregivers. Oftentimes, those are found in these resource groups. They're usually called employee resource groups or business resource groups, ERGs, BRGs. Some employers will name them something else. They're essentially affinity groups of employees who usually are volunteer-led. Employees who are passionate about a certain topic will step up and volunteer and lead these groups and form them. They oftentimes have a business responsibility. It's about sort of supporting caregivers in the workplace. Sometimes it's about testing certain things, but it's a really great audience to reach out to because that's where we can find the caregivers. Oftentimes, caregivers don't self-identify. So employers and most likely broader audiences don't know who a caregiver is. I didn't self-identify as a caregiver for the longest time. And so the terminology is a little bit different and hard to relate to when it's not a term that you're used to hearing. We often ask questions about the activities that you do in caregiving in order to identify if someone's a caregiver versus asking them if they're a caregiver. But we at ARP believe we need to find caregivers and meet them where they are to make it easier to support them. And one way to find them is if a company has an ERG. Here's one way to do that. Not all companies have ERGs. And so therefore, this toolkit can help an organization either start a dedicated caregiving ERG sort of from scratch if you're just wanting to form one, or we can help you enhance an existing ERG that you may have, whether that be a dedicated caregiving ERG or whether that be like a parents ERG group. But even the other various ERG groups out there, like multicultural groups or, veterans military groups, those you're likely to find caregivers in those groups as well. And so it's a great place to kind of meet caregivers where they are. And they are looking at these groups as platforms to share and to provide help to each other. And our toolkit, it kind of provides sort of step-by-step guidance on how to start or enhance an ERG. Our manager training is the next tool that I wanted to share with you. It's an online course and it's available for free right now. And the manager training is really critical because we know the critical role that direct supervisors and managers play when it comes to a family caregiver feeling supported or not in the workplace. You can have the best policy in your organization when it comes to benefits and supports, but if your manager doesn't allow you to take advantage of some of those, then it really doesn't matter. So our manager training focuses on helping to increase empathy amongst managers and direct supervisors, but then also it's being empathetic towards the manager who has to balance the need for supporting caregivers with also meeting the business objectives. So we talk about practical tips and knowledge on how a manager can continue to meet business objectives through things like backfilling, cross-training, outsourcing, reprioritizing, things that you can do so that the manager feels empowered to be able to allow flexibility or allow someone to take advantage of policies in a company that they may already have. Because we're sympathetic to that. You know, they're still accountable and responsible to meet your goals in the business. That still happens. And how can we do that while still being a supportive manager? So that training's available on that website right there. Next slide. Here is sort of our main toolkit on employer caregiving. It's kind of our bread and butter, and it's all about practical guidance. We have tear out tip sheets and infographics and flyers that you can use, that employers can use. Our audience tends to be HR benefits professionals, oftentimes diversity, equity, inclusion officers are our audience, sometimes C-suite. But any employee at any level in an organization can kind of use this toolkit, which you all will have received or will be receiving. It's also available online on that link. And it can really help you to get started or to enhance any existing activities that you may be doing to support family caregivers. We do have a caregiving self-assessment survey. So it's just sort of a thought starter to see where you think your organization falls. And then at the end of that survey, we show you results from approximately 150 other companies that took the survey. So you can kind of see where you are in terms of benchmarks. And a lot of this data was actually pre-COVID. And what we know is that during the pandemic, a large number of employers have taken an interest in caregiving and supporting caregivers, and a lot of employers have stepped up in terms of increasing their caregiving benefits and supports. I've seen some questions on the chat about is this related to the labor market shortage and the tight labor market? And I think absolutely caregiving could be a talent management strategy. When you're providing supports for a working family caregiver, they don't feel the need to do all the things that will impact their work and their productivity that sort of Ellen talked about, things like having to be distracted or having stalls in their promotion potential or having to quit the workforce entirely. There's certainly costs to not supporting family caregivers in the workplace, and sometimes those costs are going to be more than not supporting them. And that's something that we kind of outline in the toolkit. We talk about that business case for supporting the benefits to both the employer and the employee. We have these infographics and handouts that help increase awareness of the topic and the issue. There's the self-assessment survey. We have a sort of problem solutions section where, you know, some common problems that we hear from employers. There's some ways that we suggest that you address it in your organization. So a real great sort of foundational resource to help you with caregiving supports in the workplace. Next slide. We have kind of gone a little bit more specific with this next toolkit. This is specifically for supporting military and veteran caregivers in the workplace. As we know, caregivers are as diverse as they come. We have said that if you've met one caregiver, you've met one caregiver, and that's because they're very diverse. They come from various age backgrounds, marital status, gender, points of where they are in their career. And then multicultural, racial, ethnic differences. And there's different types of caregivers. There's military veteran caregivers. There's people who are caring for people with disabilities, caregivers of young children, and caregivers of older adults. And so however way you cut it, there's going to be caregivers in your organization. In fact, Harvard Business Review, I think, indicated that at any given point, it's likely 3 out of 4 of employees are caring for someone in some capacity in your organization. We drilled down specifically into this population because of the interest among employers to do more for military veteran caregivers who have a unique situation where it may be more difficult for people who are military caregivers to find employment because of the amount of time that they move or the commitment that it takes. And so we partnered with the U.S. Chamber of Commerce Foundation's Hiring Our Heroes program, as well as Elizabeth Dole Foundation, to create this toolkit that really talks about sort of recruitment strategies and how to support military caregivers in the workplace. But again, this is just one subset of a population that really experiences caregiving differently. As we know, caregiving is an intersectional topic in the workplace. It is very much a DE&I issue, believe it or not, because of the fact that caregivers across the different groups that I talked about do experience caregiving impacts disproportionately. There are disparities among family caregivers. And then secondly, we know that types of caregivers within companies don't always experience the same benefits and support. We've seen throughout the past decades a large number of employers stepping up to help parents of children. However, elder care, although many employers are stepping up, continues to lag behind childcare when it comes to policies and benefits. And AARP's perspective is, let's try to treat caregivers holistically in your organization. And if you're going to provide one type of benefit for one type of caregivers, can you also provide an equitable benefit for another subset of caregivers? So there is sort of a DE&I angle to caregiving supports in the workplace. The next slide. Small business caregiving. We have an online resource guide. And we've partnered with our consultants at Public-Private Strategies to really focus on the needs of small business owners who really have all the best intentions and want to provide help and support, but oftentimes may not have as many resources, or their structure is different where they don't have like a full-blown human resource benefits department who can help implement some of the suggestions and best practices that we have. So this small business guide will focus much more on the no-cost, low-cost solutions for small businesses to still be able to provide supports to your working family caregivers. We know many small businesses sort of operate and treat their employees like family, and sometimes they are sort of family-owned businesses. And so what can they do to support? And this is going to be a practical guide on how small businesses can do more. Next slide. A couple other resources. This is more data and research that we've done. A few years old now at this point. I think around 2016 is when these were released. And so we know a lot of change has happened, I think, since the pandemic, and the culture of work is changing and the future of work is changing. But we just wanted to share a document that we have where we outline case studies of various employers who are doing promising practices when it comes to supporting working caregivers. It's going to be from the for-profit and nonprofit worlds. It's going to capture all different types of benefits, policies, and supports. We've seen anything from sort of paid leave, dedicated caregiving leave, all the way to providing a navigator on site, or providing backup care services for elder care, as well as child care, making sure those resources and services are equitable. We've seen ERG groups, affinity groups, support groups, that kind of thing. And then also just simply providing lists of resources to the employees is a way to offer support. Are there local nonprofits, disease management groups, community-based organizations, AAAs that an employer can sort of provide the contact information? AARP's state offices, certainly, as well as our national caregiving resources, is one way to point people to trusted, unbiased sources of information around family caregiving. And so we highlight some of those best practices in these case studies. I talked about the business case for supporting caregivers, and our report that we conducted with React is going to highlight that there's actually a dollar amount that we were able to calculate in terms of return on investment when employers offer practices like flex time and telecommuting. We were able to calculate return on investment anywhere between $1.70 to $4.45. So there is a business case and the why for wanting to support family caregivers. Next slide. So those were our dedicated resources for employers, those in the sort of HR benefits space, the C-suite, the DE&I professionals, like I mentioned. We also have, as you all may know, a plethora of resources for working family caregivers. These are our consumer-based caregiving resources. And there's a large number of them, and I'm just going to highlight and maybe breeze through what we have. When I talked about sort of sharing a list of resources to give to your employees, feel free to pull from these resources or consider adding these to the list. All of our stuff is sort of fair game when it comes to distributing to the employee caregivers themselves. And most of our resources are going to be free and available online and or in hard copy. And so we'll just sort of breeze through, I think, maybe the top ones that I think are most relevant. Next slide. First and foremost is our ARP Family Caregiving Guide. It used to be called Prepare to Care, and we still kind of use that terminology. The thing with the term Prepare to Care is that not everyone is always in preparation mode. Many people are just sort of thrown into their caregiving situation, but this Family Caregiving Guide can help you at any stage of your caregiving journey. We have it transcreated in multiple versions. We have one for LGBTQ, we have one in Spanish, we have one in Chinese, we have a military caregiving guide. So there's all different versions of this, and it's available for free at arp.org/workandcare. People can order hard copies. So I've encouraged employers to order a number of copies for their employees to distribute if they're going to have an event like a health or benefits fair or open enrollment type fair, or a ERG support group type of session. Provide copies and provide links to the different versions that we have here. It is a wonderful guide, kind of 101, that helps you navigate your caregiving journey no matter where you are. We're not going to provide a one-size-fits-all solution in this, but it does provide a framework on how people can sort of get their grasp around caregiving, because we know that it can be overwhelming. So this framework is a great step-by-step guide on how to kind of just get your bearings when it comes to caregiving and how you can form a team to really help support you. And there's worksheets in the back of this book, which is why I think hard copy, it does come to life. Very practical. You're documenting where important papers are, who are the contact information of healthcare providers for your loved ones, all the way down to what are the trash pickup days for your loved one. Do you know that? If you needed to step in and do things like that in the home for someone, would you know that kind of information? Next slide. Our financial caregiving workbook is another one, very practical guidance. It's all about how you can manage your money as well as your loved one's money. Ellen referenced that there are out-of-pocket costs that caregivers experience. It's on average $7,300 out of pocket that a caregiver spends to care for a loved one. And if you're a long distance caregiver, that number goes up to $11,000, $12,000 on average. These are average costs. Imagine if you are maybe sort of earlier in your career and just starting working, and you may not have reached yet sort of the peak salary that you're trying to make. $7,000, $12,000 can be a large proportion of that income. And so what can you do to equip caregivers with the knowledge they need to budget, to manage finances, to know what assets and benefits are available for their loved ones, so they don't have to keep reaching deep down into their own pockets and jeopardizing their own financial future. So another great one, we have this transcreated in multiple versions as well. Next slide. A long list of more slides. We know caregiving can be incredibly local. I work at the national office, but as you all know, in Illinois, caregiving is local. You want to find those resources. We have a tool called the Community Resource Finder that we have developed in conjunction and partnership with the Alzheimer's Association. However, it's not just a tool for people caring for someone with Alzheimer's or dementia. It is a tool that any caregiver can use, and it's zip code based. So you would check the category that you're interested in terms of services and resources. You enter your zip code and you'll be able to come up with a list. We pull from, I think, over 400 data sources to kind of pull up what local resources are available. And then AARP has local resources and solutions. There's a local section on our caregiving site. And then the third link here is all about our family caregiver state resource guides. All of our states have a state-specific resource guide with state-based caregiving resources. Next slide. And more resources. This Facebook group is one of my favorites. I'm a member myself, and I love sort of the vulnerability, the tips that people share, the support that we see coming from members of this Facebook group. It's very honest, and people, again, are very helpful and supportive of each other. And it's a very organic group. It's not something sort of overly moderated, but it's a wonderful place of support. And so that's a really great place to find some information. You may even be able to find some local caregivers who could recommend local resources in your area as well. Our main website for caregiving is aarp.org/caregiving. It's also available in Spanish. That's our Caregiving Resource Center. Our online community is going to have multiple threads of conversations online about various topics. So feel free to start a new thread, or you can kind of join any conversation that's there. We know that caregivers do a lot of medical nursing tasks, and so how do they do that? Oftentimes they're not trained. And so we have videos that can help people do those types of tasks. And then lastly, our caregiver resource line. You're welcome to call at any time if you have any questions and need information and referrals. I think we just have one more slide and then I'll be all done. I just wanted to share our webinars. We have a number of webinars on demand as well as live. They happen throughout the year, and you can check out those two websites that show which topics you're interested in. We also cover things like Medicare. Medicare is also another topic that's difficult to navigate with, especially caregivers who are trying to navigate that. But lots of deeper dive topics that we do in caregiving and Medicare that you can kind of tune in and share with employees these links, and they can kind of do these on their own time. Thank you. I think that's it.
Thank you so much, Tricia. I don't see that there are any questions in the chat. If you have any, please enter them now. Yes, the session is being recorded and will be shared after the in a follow-up email with other resources. Okay, thank you so much, Tricia. Our final presentation is from AgeGuide's own CEO, Marla Frantek, and she will talk more about resources on the local level, the home and community-based services to support caregivers and the people that they care for.
Yeah, thanks, Lucinda. Oh my goodness, did we get some good information going here today? I hope everybody is beginning to see the importance of supporting family caregivers as part of an employee-friendly workplace. You've heard the range of care from childcare to elder care really spans every demographic and honestly, every level of an organization. I myself was recently experiencing that with caring for my sister. So it happens at any time, at any space, and it comes and goes in caregiving. So we really do have to recognize that. You know, as Tricia said, more people are entering that sandwich generation, providing that care for both children and older adults simultaneously. I love her reference to the panini one, because we're starting to feel like sandwich is just too gentle a term to really describe the stressors that we feel, the physical, the emotional, those financial burdens that workers are facing are just going to continue to grow. So really, in the absence of a supportive care culture at work, many of these employees hide their burden of caregiving responsibilities. They do struggle in silence, you've heard, while balancing work and caregiving, often dealing with those unexpected reoccurring care obligations that require those mental, physical, and financial resources to help address them. Their productivity suffers accordingly, which often costs the organization too. And they, unfortunately, when that emotional and physical stress becomes too much, their capacity for work becomes impaired. Some respond by reducing their work hours. You've heard about that today. Others drop out of the workforce altogether. And eventually our employers are paying a price by losing these talented, trained employees. So the most significant factors that you've heard about here today that contribute to that workers quitting were maybe their unaffordable costs for paid help, their inability to find good help, and their inability to meet those work responsibilities due to increasing caregiving responsibilities. All of these are areas where employers could conceivably provide guidance, support, and resources. So being a caregiver doesn't come with an instruction manual, but I hope today that you're finding out that there are resources there to help. Next slide. So a key benefit that employers can offer is connecting people to the aging network that is currently available in their community to support caregiving for an older adult. So what is this aging network? Well, in 1965, the Older Americans Act made it the responsibility of the federal and state governments to assist older adults in maintaining their best possible physical and mental health without regard to economic status. The Older Americans Act authorized area agencies on aging like Age Guide to coordinate a local network of Older American Act funded services and supports that can help older adults maintain their well-being and offer protection against abuse, neglect, and exploitation. Age Guide is, or what we heard, AAAs, you heard Trisha referring to that before. We're one of 13 that are in Illinois, but we are across the nation. There is a AAA for every area. Our service region here for Age Guide covers the counties of DuPage, Grundy, Kane, Kankakee, Kendall, Lake, McHenry, and Will counties. Here at Age Guide, we are empowering older adults to remain independent, connected, and to age well. And we advance this mission by funding federal Older American Act services that are needs-based, which means there are no financial restrictions. They're available to all persons age 60 and over, caregivers age 18 and older who are caring for an older adult or caring for someone with dementia of any age, and most importantly, in a growing population of grandparents raising grandchildren. Next slide. AAAs understand that helping people navigate health services and access to home and community-based services is vital in keeping people in their home longer. Everything we do supports aging in place, keeping older adults and people with disabilities in their homes and providing alternatives to nursing home care. And our role is primarily to be that local resource for information on long-term services and supports. But we also have a role in advocating by weighing in on policymaking at the local, state, and federal levels. You heard Ellen talk about this a little bit earlier, that we want to affect policy change that supports aging in home and in the community with maximum health, independence, and well-being. This advocacy work is one of the reasons why we are here today, so that we can educate people on what is available and how we can make sure those services and supports are there when they do need them. Next slide. So you can see here on the screen, there is an array of home and community-based services that are funded at the local level by AAAs throughout the state of Illinois. Each of these are essential human services that can vastly improve the lives and enable older adults to live independently in their home and community. These home and community-based services address daily living needs of older adults and their caregivers, such as meal programs and transportation. And these services, again, are provided at no cost and available to any older adult that needs them, regardless of their insurance, their income, or their assets. Because home and community-based services cost just a fraction of the cost of that institutional care options like nursing homes, bringing these services to where people live not only saves money, but it can allow people to continue working. With the leadership from the Illinois Department on Aging, AAA's fund a multitude of local service providers known as caregiver resource centers to deliver a variety of resources and services for people caring for an older adult or a grandparent raising a grandchild. Next slide. I'm sure many of you listening today are or have been a caregiver for a loved one. One of our favorite quotes that we love to share with everyone was from our former First Lady, Rosalind Carter, who stated there really are only 4 types of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. Interesting, as I shared, many caregivers do not identify as such. And we've heard this, from each of our speakers today. They're just doing what needs to be done. They're fulfilling their roles as a spouse, a daughter, a son, and really they are often hesitant to even consider themselves as a caregiver. So we are really stressing to our employers that they need to recognize that these caregivers often will not ask for help. So we are all charged with identifying them and seeing what they are in need of and supporting and connecting them with these home and community-based services. Because when the needs of caregivers are addressed, their loved ones benefit too. Next slide. As you can see on this slide, there are a number of supportive services available for people providing unpaid care. And the eligibility for these services are a little different than some of our other Older American Act services. There are 3 main categories of people who qualify for caregiver support. Anyone 18 or older who is caring for another person age 60 and older, grandparents and other relatives age 55 and older who are the primary caregiver of a child who is 18 years old or younger. These resources can range from including things like helping pay for summer camps, recreational programs, clothing, and other essentials that might not be able to be afforded by those caregivers. As Tricia said, especially those who are on limited resources. And finally, any relative age 55 and older who is caring for an adult child with a disability can also qualify for these family caregiver services. Caregiver assistance helps those unpaid family caregivers obtain access to the services and resources that are available within their communities. Services such as respite care. I know there was a question earlier that people were asking about that. Respite care is really that temporary substitute or support, or sometimes a living arrangement for the care receiver so that the caregiver can have an emotional or physical break, as well as providing those resources for their continued well-being. We also offer supplemental funds. As Tricia pointed out, the out-of-pocket expenses can be tremendous for family caregivers. So these supplemental funds can pay for short-term caregiver services, adaptive devices, and other supplies that are not covered by insurance. We can provide caregiver legal services to protect caregivers' legal rights and the rights of the relative raising a child, or we can even provide legal advice and legal education. We offer individual counseling programs. These are there to give advice, guidance, and coaching to an individual caregiver. There are caregiver training programs that are there to educate people, either individually or in group settings. And support groups are available in group settings to provide advice, guidance, and support to caregivers on an ongoing basis. The state of Illinois also helps us with funding for those caring for someone with Alzheimer's disease and related dementias. This can be financial assistance for things like chore housekeeping, maybe grocery shopping services, maybe assistance with rent, mortgage, or utilities, maybe short-term medication supplies. They can be home improvements for accessibility, safety, accessibility and safety, sorry, transportation, including rides, vehicle adaption, technologies such as WanderGuard prevention systems, Amazon Alexa devices, security cameras, robotic pets, sensory quilts, even things like dentures, hearing aids, and wearable GPS devices can be covered through these programs. Next slide. A newer caregiver assistance service that's being implemented throughout the state of Illinois is an evidence-based intervention called TCare. TCare uses software to help identify the unique needs of a family caregiver and target services and supports that address them. TCare is accredited by the Federal Administration on Community Living and has been built on over 30 years of research. This caregiver protocol has been proven to reduce stress and depression in caregivers in as little as 3 months. And the research has shown that those who exhibit the most confidence in their caregiving role really actually do score some of the highest risk in caregiving. So really counter to what we would think that would be is really what we find time and time again. These trained TCare specialists use this software to measure the caregiver's cause of burden, and then they work with them to create a support plan with some strategies and goals that are individually tailored to support that caregiver. After a caregiver completes this initial screening, a referral is sent to the caregiver provider agency to complete a TCare assessment with that caregiver. When these caregivers work with the TCare specialist, they start to begin to realize and really understand why they're overwhelmed. And then we get to link them to the specific services that address their unique needs. Next slide. In addition to these services that are provided throughout the state and all of the area agencies and their local caregiver resource centers, we wanted to share with you that the Illinois Department on Aging also funds care coordination units to provide a free in-home comprehensive assessment to any Illinois resident age 60 and older to determine what services and supports that older adult may need to safely remain in their home. The state can pay for some long-term care services through the community care program, but this particular program is only available to persons at risk of nursing home placement and with assets under $17,500. Some of the services that can be paid for through that program are some in-home care, emergency home response, adult day services, and medication management. Next slide. So you can see that a collaboration between employers and the Aging Network can help working caregivers access health services and these home and community-based services that are crucial in keeping older adults healthy and independent. We need to expand our focus on the needs of caregivers so they can better care for themselves and the ones they're caring for. We hope that after today, you'll help us by joining in this effort to create awareness among caregivers that their contributions are invaluable and recognizing that their work is very challenging. There are supports for them, so I encourage you, if you take one thing away from my message here today and from all the other messages, you will refer your employees to take a caregiver screening. Kind of like that phrase, there's an app for that. Well, there's a resource for that. And it's better than an app because it's a human connection to guide you. Someone who is there to really help navigate all of the resources that are out there and tailor them to someone's unique needs. There's a link to the screening tool here on your screen. And if you have employees who are caregiving, please encourage them to contact AgeGuide, and we can contact them with their local caregiver resource center so they can benefit from all of the resources that are available. Together, we can create more caring companies that help employees manage their caregiving responsibilities while reducing costs and increasing everyone's productivity. Thank you.
Thank you so much, Marla. Are there any questions for Marla? I don't see any in the chat. I don't think. Okay, well, we will wrap up. Thank you all again for your time in attending our presentation today. Again, we will be sending out some follow-up materials, including the PowerPoint. Tricia added another resource from AARP, a link to a resource, so we will also include that. So please watch for your emails. If you have any questions about how to access resources in our region or outside of our region, we can connect you to other areas of the state, or if you are looking for resources outside of Illinois, we can point you in the right direction. Please reach out and also take the survey when you leave the session so that we have some feedback and hopefully some topics for some further education. Thank you all and have a wonderful day and happy holidays.